station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to Bobo 103.1 FM. It's Dane hanging out with you, and every single week we have the opportunity and the privilege to do the show that's all courtesy of HSA, where we talk all things just around the healthcare industry, specialty. Maybe there's a workshop that's happening. Maybe there's a conference. Or maybe we get to meet, obviously, a new doctor that has made their way here to the Cayman Islands for the first time. But today we have the privilege of interviewing a nurse that's joining us from HSA. I'm going to have her introduce herself, just how long she has been in her department. Well, obviously, she's going to start with what her specialty is first and how long she's been serving with HSA. Whatever time it is. Good afternoon, good morning, good night. Whatever time the listeners are going to be listening to this. How are you doing this morning?
Hi, I'm doing very well. My name is Janelle Overholt. I work at the Health Services Authority in Georgetown. I'm a dialysis nurse specializing in kidney care, I'm a dialysis nurse specializing in renal care. And I've been with the dialysis unit now for about 5 years this year.
Oh, wow.
So, and before that, I've been a nurse for almost 10 years at this point.
Okay. What made you want to get into nursing at first?
I like caring for people. I like seeing patients progress. I like seeing the progression of sick patients getting well. Yeah. And it's very satisfying to watch somebody come in, sometimes nigh to the point of death, and then you bring them back from that, and then they go on to go, back home with their families and stuff like that. So
that's pretty cool. I like how you broke that down, because you basically explain what are the benefits for doing what you're doing and why you feel like there's a purpose behind it. And I love that how you just brought that in with saying, like, you see somebody come in, because the kidney is a very important function in our body, and you see them coming in near to death, and all of a sudden you guys, because of your expertise, you're able to revive them back. That's amazing. Unfortunately for some, that's a different message sometimes, and there's always a good and a bad part of the job. Right. Same thing for me, right? Yes. We'll talk about that at some point of the show. I would definitely want to talk about that, but we want to talk about all things kidney function, just all around kidney. How important is this instrument? I like to refer to it in our body. We don't often think about it until it's brought up, because something may have happened that either it's affecting us in our function of our kidney, or, maybe we hear about it from a friend or a family member that they're being affected, and there may need to be at some point a transplant that needs to happen, right? But let me ask the first question. What exactly do our kidneys do, and why are they so important?
Oh, the kidneys are very important for the body. Like you said, it often gets overlooked, right? Because we don't think of it as a main organ as like the heart or the lungs or something. Yeah. But the kidneys are two bean-shaped organs. They're right below your rib cage, one on either side of your spine. They are responsible for fluid balance in the body, as well as filtering toxins out of the body, balancing electrolytes like potassium, calcium, magnesium, phosphorus, stuff like that. Yeah. In addition to all of those things, they also release hormones that control your blood pressure and control your red blood cell production. Oh, wow. So they do more than just excrete urine, right? They maintain balance in the body across the board. Yeah. In short, the kidneys help balance the body, like I'm saying. Yeah. When kidney function declines, multiple systems are affected.
Yeah. That's good. It's good to know. Now, what I want to ask, I think I know the answer to this already, because it's been told to me because my daughter is a future doctor, right? She is what she's been studying. But can you live on one kidney.
Yes.
Yeah.
Patients live with one kidney. There are patients that are born with one kidney that lead normal lives.
Oh, wow.
You have kidney donors that will give their kidney to someone else, and then they have one remaining. You have, of course, the recipients that are living with one kidney. But it's important to protect the kidney in that case because they have less reserve than someone with two kidneys, right? So they would have to monitor their blood pressure regularly and avoid kidney damaging medications.
Yeah. And what is, I'm glad you touched on that. What is the disease, like something that can destroy kidneys? What is a medicine that can destroy that?
Some antibiotics are very hard on the kidneys. Some pain medications called NSAIDs. So these are things like Motrin, Advil, Voltaren.
Advil, wow.
Yeah, if it's not right away, right? It's over time in high doses. Those can affect the kidneys over time. Obviously, for antibiotics, if the doctor prescribes, you have to take it as prescribed. But often the doctor will do a check on your kidneys before prescribing certain medications because it can affect.
Yeah. Do you think that there's certain food that we eat too that would affect our kidneys? And you're the expert, so I wanted to ask you this question. Like, do you think that there are certain things that we eat out there, or is it like a perception to people?
Maybe not stuff that you eat, but dehydration, which I think we're going to touch on.
Yeah.
Dehydration is a major cause of what's called acute kidney injury. So things like Red Bull and Monsters, high caffeine stuff will make your, things like Red Bull.
The high energy coffee you were mentioning earlier. Yeah.
Will dehydrate your body, and that will damage the kidneys. It can happen really quickly.
Yeah.
As far as food, I can't think of any off the top of my head.
Yeah, no, it's good. I just wanted to ask the question because sometimes, we don't think of certain things. Like when you just said that, like certain medication, we got to be very careful because it can be destructive to our kidneys. You never really think about that. Like, especially when you go to a doctor, you're just happy to get some form of medicine sometimes, especially things when if you have a headache. A lot of people are going and rushing for an Advil. Yeah. Right? But you're not thinking, I'm doing this to get rid of this pain, but I'm also potentially over time destroying, because there's so many people that take an Advil like it's buying a Skittles at a gas station, and that heals the pain, and they do that daily. So over time, you got to be very careful. All right, what is chronic kidney disease?
Chronic kidney disease is the decline in the kidney function over a period of time. It's chronic. It doesn't show up suddenly. The issue with chronic kidney disease is that it often doesn't present any symptoms right away. So a lot of patients won't find out they have chronic kidney disease until it's like in the later stages when they start feeling sick, they start feeling bad, and then they go to the doctor to get checked. And the numbers show that their kidneys have been in decline for some time. Yeah. So it's not just about kidney failure, it's about progressive decline that can be slowed significantly with early detection and proper management.
Yeah. Okay. Wow. And you mentioned this before. And what is an acute kidney injury, and how is it different from what we just spoke about?
Acute kidney injury is a sudden like injury to the kidney. So it can happen within hours or days. It often is caused by dehydration, like we mentioned. Sometimes infections that get out of hand. Right, major surgery, certain medications, or blocked urine flow that will injure the kidneys. Unlike CKD, AKI can sometimes be reversed if we treat it quickly. Yeah. However, severe AKI can cause permanent damage and increase the risk of developing the CKD later. So CKD, like I said, is the gradual decline. AKI is sudden and often will present symptoms quickly.
Yeah. Okay. That's good to know. Now, I want to know, because I've always asked this of the doctors or any nurse that come in, obviously, we are living in a period of life right now where we're seeing so many people that are going through so many situations where they're here today but gone tomorrow. They, go to bed, they don't wake up, and they ignored signs of essential things to their health, right? So I want to ask you, what are the early warning signs of chronic kidney disease?
The early warning signs, like I was saying, in the early stages of CKD, there are no warning signs. That's why it's important to get regular checkups. But as the disease progresses, the patient might start feeling fatigued, start have swelling in their ankles or in their face. They might have heart palpitations. They might have muscle cramps. They'll not want to eat. They'll be nauseated. or they might have froth in their urine. Like their urine will be frothy because of the proteins that are spilling into the urine.
Yeah. Talking about that, what symptoms should we not ignore?
Symptoms to not ignore, definitely chest pain, severe swelling, especially if it shows up over a short period of time, right? Shortness of breath, any kind of confusion or like changes in your mental status, blood in the urine, vomiting, or if there's a sudden decrease in the amount of urine you're producing, or even the opposite, a large increase in urine all of a sudden. Just any changes like that should probably get checked out right away.
Yeah, for sure. And then who would you say is more at risk? If anybody's listening right now and they're saying to themselves, okay, well, who's at risk for this type of disease, this type of kidney disease? Am I more at risk because of, this certain type diabetes I may have, or, Yes,
diabetes definitely, I would say, is probably the number one cause of chronic kidney disease, diabetes, and high blood pressure. Those are two major causes of chronic kidney disease. So doctors will actually include kidney function tests when they're regularly checking up patients with hypertension or diabetes. Obviously, if you have them combined, that's even more a bigger risk, that it's very important to be compliant with your medications and keeping your blood pressure and blood sugar under control.
I'm just saying this right now when I'm pre-diabetic and I just had like 4 or 5 Skittles a couple minutes ago. I got to be very careful. All right, man, we're going to take a short commercial break. When we come back, we'll discuss more around your kidney health and just how it functions, and more education on this topic that sometimes, if I have to be very honest, we tend to ignore. We'll be right back.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, we are back. Welcome to Bobo 103.1 FM. It's Dane hanging out with you on a beautiful Friday. By the way, happy Easter for all the campers out there. Hopefully you're enjoying the show. I know there's some people on the campsite that's listening to us right now. If you have any questions, go ahead and send it to our Facebook or Instagram at Bobo 103.1 FM. We'll have our guests introduce themselves again and their position and how long they've been with the HSA team. Go ahead.
Hi, my name is Janelle Overholt. I am a dialysis nurse at HSA, and I've been a dialysis nurse for the past 5 years.
So we were talking all things around kidney health, kidney disease. We have chronic kidney disease. We have, what's the next one again?
Acute kidney injury.
Acute, yes, that's right. And just like some of the, I think some of the most important questions were like, who's more at risk? Some of the things that we talked about were people that suffer with diabetes, high blood pressure, obesity also.
Yes, obesity. And if you have a family history of, if people in your family have chronic kidney disease, also those with heart disease, autoimmune diseases like lupus or multiple sclerosis, long-term use of certain pain medications like we were mentioning, the Advil and Motrin, Voltaren, things like that, and just age over 60.
Yeah, as you get up there in age, you definitely have to be observant, go to the doctor, get regular checkups. Now, why do diabetes and hypertension damage the kidneys?
So with diabetes and hypertension, it's actually twofold. I'll talk about hypertension first. With hypertension, the blood vessels are under pressure, right? So over time, that will damage the blood vessels and the blood supply to the kidneys, and the kidneys won't filter as effectively. With diabetes, the filters in the kidneys are tiny little filters called nephrons. So over time, high blood sugar will damage the nephrons, and that will decrease the filtering ability of the kidneys.
Yeah.
The high blood sugar also will destroy the vessels as well. So that's why of the two, the diabetes is a little bit more dangerous, right? If you think of it that way, because it's from both ends, right?
Yeah.
So with both conditions present, again, it's accelerating that process.
Now, this is scary to ask, only because I told you before that, I just found out recently I got to take it easy on the sugar and the food that I'm eating because I'm pre-diabetic, right? But how common is kidney disease amongst people with diabetes?
With people with diabetes, 1 in 3 people with diabetes will eventually develop chronic kidney disease, especially if they're not compliant with their medications or their treatment regimen, given from the doctor. That's the main point with, why we're here today, is to spread awareness about being compliant, getting your regular checkups, especially if you have these pre-existing conditions.
Yeah. All right. How is it diagnosed? Like, how do you find out?
Like I said before, we were talking about the signs and symptoms, how they don't actually show up for a while. So the doctors will do a blood test, and they'll measure creatinine, which is one of the toxins that that's in your blood that your kidneys will excrete.
Yeah.
They'll measure creatinine to calculate what's called the eGFR, which is the glomerular filtration rate. That's the effectiveness of how your kidneys are removing the toxins out of your body, right? We can also do a urine test, which will measure the protein in the urine. And so these are routine tests that can be done to detect problems long before the symptoms appear. So you don't have to have symptoms for the test to show,
Yeah. This is an important message, man. I'm glad that we're talking about this because, like I said, things that we don't think about, and it should be treated in some form of urgency. What is eGFR? I saw this on our paper. What does this mean? Can you break this down for us?
The eGFR is the estimated glomerular filtration rate, and it shows how well your kidneys are filtering your blood. So it shows the percentage of clearance, you could say, of toxins from your body, which I say toxins, but it's more the creatinine, like I said, that comes from your muscles just being used. Your body builds up creatinine that's excreted in the urine.
Yeah.
Your electrolytes and fluid. So just balancing these things. So the eGFR estimates how well your kidneys are doing all of this. 90% or above is normal. 60 to 89% is a mild reduction. Below 60, if your kidneys are functioning below 60%, that's considered CKD.
Yeah.
Below 15% is kidney failure.
Wow.
So the lower the number, the more reduced the function. But like I said, if we're catching this early, doctors can prescribe medications or treatments to help slow down the progression from, if let's say you're at 89%, to slow it down so we don't get to that 15%.
Yeah.
Which there have been patients that I've seen that have been successfully treated. CKD is not it's not reversible, right? You can't, once you have it, you can't get rid of it. It's not.
Yeah.
But we can slow the progression.
Yeah.
Right.
That's good to know, though. That's good to know. There's some form of slowing that process down. How is CKD staged?
There are 5 stages of chronic kidney disease. Stage 1 is kidney damage, but you still have a normal GFR, so that's above 90, but there's some kidney damage, right? Stage 2, mild reduction. Stage 3, moderate. Stage 4 is severe. By the time the patient reaches, or if we find a patient with stage 4 kidney disease, at that point, we're starting to prep them for maybe possibly going on dialysis. Because once they reach stage 5, a lot of times those patients don't produce urine at all, and they need dialysis to help the kidneys, to do the job of the kidneys, essentially.
Yeah. Okay, it's good to know. How about how often, if somebody's at risk, how often should they be screened?
Preferably once every year, maybe once every 6 months. The doctor will decide based on your risk factors, like we're saying, if they have diabetes or hypertension. That might be more frequent, but as a general rule, we do this once a year as part of your annual checkups.
Yeah. And this one is very important too. Lifestyle, which is just got to be very, very concerned about this one. What lifestyle habits protect your kidney health?
Just with the blood pressure and blood sugar control. But even if you're not diabetic or hypertensive, we can all reduce our salt intake, staying physically active, maintaining healthy weight, right? Avoiding smoking, and using the NSAIDs, that's the pain medications, like I said, moderately. If your pain is uncontrolled where you need the medication every day, maybe that's something to go in for, right? I know in Cayman we tend to say, I don't want to go to the doctor. I'm just going to treat it myself at home. I'll just drink this tea or whatever.
There's a leaf outside I can
Yes, right. But if it's an ongoing issue, I would say don't sleep on it. Go get it checked out. The doctors will prescribe the right medication, because not all pain is the same. I know we're kind of going on a tangent here, but once you start compounding the medications, that add stress to your kidneys or even your liver or, your heart and stuff like that. And then finally is staying hydrated.
Yeah.
Because the fluid will help flush the kidneys and keep them clear, keep them working.
Which you've heard constantly. Drink 8 glasses of water.
Yes.
This helps you with your kidney. So that would lead me to my next question. Can dehydration obviously cause kidney disease?
Yes. Yeah. Dehydration is the main cause of acute kidney injury in particular. I've seen patients come in that have been, well, this is when I was on my experience on the medical ward. I've seen patients come in with acute kidney injury who have been drinking Monster or Red Bull or just not drinking water at all, and their kidneys are taking the hit for it. So the treatment for that is to rehydrate the patient, often a large amount of fluid in a short space of time, so that they can hopefully get the kidney function back up. And I've seen it work. I've seen acute kidney injury be reversed, and the patient was able to go home, not have to go on dialysis. They just do their regular checkups every year.
That's the good news we were talking about earlier in the show. Now, how does the kidney disease affect the heart?
With the fluid overload, the extra fluid in the blood, if the kidneys cannot process that fluid and excrete it properly, the heart will be under pressure with all that extra fluid in the blood. So we've seen patients with heart failure. Once they get fluid overloaded, their heart just can't manage, and then they would have to get dialysis. Sometimes it helps and they're able to go back home, but the heart is under pressure. Also, not just the fluid, but the potassium, particularly potassium in the blood, and even calcium. If there's too much of those two in particular, the way that the heart pumps is changed.
Yeah.
And sometimes, especially if you have comorbidities along with that might not work out in the best for the patient.
Yeah. We're coming to the end of our segment to the show. This has been a wonderful topic. One thing I want to touch on is 2 questions actually before we go. It's just supplements. I want to talk about that. Is it safe for the kidneys to take supplements? Because I know a lot of our listeners perhaps are in the gym or in life, you take supplements regardless. So is that safe? That's the first question. And then I'll have the last one for you at the end of this one.
Supplements are generally safe, but some of them in high doses can affect how the kidneys function, especially if you're not backing it up with enough water.
Yeah.
Right? So our advice as nurses to patients is, if you're going to start a supplement, make sure you clear it with your doctor first, and then the doctor can give better guidance on how that will go.
Yeah. Guys, stop making AI be your doctor too. Go to a real doctor. Talk to a real doctor, please. Last question is, I want to ask you, what is your last key message for the Cayman Islands, for the community?
I just wanted to get it out there that kidney disease is serious.
Yeah.
But the good news is that if it's caught early, it doesn't have to be, right? If you have diabetes or hypertension, make sure to get your checkups every year or every 6 months, however often your doctor recommends. But early detection allows treatment that can slow progression to prevent dialysis.
Yeah.
We have a lot of people in Cayman that they have kidney disease, but they don't have to be on dialysis because they're working with their doctors to
just to get it sorted out.
Right.
Like to get it fixed and sorted out. I think this was a wealth of information, and you definitely, I know she wouldn't admit this on the radio, but she did come in a little bit nervous, but she did a wonderful job. I was actually pleased with how she performed today on the show. And it's always easy when you're in your field and I'm nervous sitting in the chair. You're telling me everything that I need to do. And now you're in this chair, which is, by the way, it can break your nerves a little bit. Radio is not easy. They said that public speaking, swimming with sharks, and jumping from an airplane are some of the hardest things to do. But you did a wonderful job. All right.
Thank you. Thank you for having me here today.
Yes, for sure. It was our pleasure. And thank you so much for the information also. It was a wealth of information, and we really do appreciate it. Don't forget, if she may not have answered every single question, I think she did. But if there was something that was missed out, go ahead. Send us a message. We'll get it over to her team or the marketing team at Bobo 103.1 FM on Facebook or Instagram. Have a wonderful Easter.